Greetings once again. It's a pleasure to be back and to just share with you and discuss some of the insights that I've gained over the couple of weeks that have passed. So, for this particular session for today, I'm going to talk about the role of KEMSA in primary healthcare service delivery. And this just to give a brief breakdown on what are the key aspects that I feel we need to look at. And this conversation was brought by a colleague when we were having a chat yesterday during World Pharmacist Day, and the concern for her was how do we engage and actually ensure that the Kenya Medical Supplies Authority is able to deliver on the government's primary healthcare service delivery model, and also in line with the global priority to ensure that people in communities where they live and where they cohabit are able to access the healthcare services that they need, and also are able to attain positive health outcomes out of the use of these healthcare services and products. So on that account, then for me, the key bit was to look at it as KEMSA, Kenya Medical Supplies Authority, what is their mandate? And that is one thing that we know, it's a supply of health products and technologies with a focus on the public sector. So looking at that, what opportunities lie therein that could be critical for us to ensure we deliver on the primary healthcare agenda, but also KEMSA plays its role, and what role does it have in that space? So that is the core of our discussion. And at the end of the day, we get to come up with some of the next steps that I feel these need to be adopted by the KEMSA leadership and the KEMSA team to ensure that we are able to drive that agenda where it needs to be. So to start it off, I think knowing that KEMSA, the core mandate of the organization is to ensure reliable supply of health products and technologies to the respective public health institutions, that is in the different counties and even from a national government dimension, where we look at the referral health facilities, the level 6 facilities. Kenyatta National Hospital, KUTRH, we're talking about Moi Teaching and Referral Hospital. So when we look at these dynamics, the key bit we need to ask ourselves, as a medical supplies agency, what is their core mandate? To ensure there's reliable access to medicines to patients and to the facilities, which will now make them available to patients. So on that account, what are the key aspects that come in? The first area when we look at that is in terms of the supply chain, because that is the core of their mandate. Then what does that supply chain entail for them? The supply chain will entail forecasting and actually knowing what quantities of products do we need to supply in these different areas, and is it pegged on the morbidity data, that is the diseases that we are dealing with, and on medication that are based on the treatment guidelines that are indicated for such conditions, or what are the parameters that we're going to use. So we need to do forecasting and ensure we have the clear figures on what quantities are needed at what points in time, so that we also don't have expiries within the warehouses, but at the same time, we ensure that these products are able to get to people who need them when they need them. So it's kind of a balance between getting overstocking to end up having expiries and wastages, or understocking where people are not able to get the medicines they need. So we look at that forecasting. In the procurement cycle, we need to ensure the affordability of the medicines. What procurement methods are we going to adopt? We'll say the competitive procurement process, where we get different bidders with different quotes on the different products that we need, giving us a competitive advantage in getting the best quality, but at the lowest price possible. So what procurement methods are we having, and what are the different products that we need? Can we single source them or competitively source for them? And what are the legal provisions? And that is the Public Procurement and Asset Disposal Act, which we need to look at. How does KEMSA apply that? Then we have the supply and reverse logistics management, which is a critical bit for us. The supply of the medicines, once the KEMSA warehouses have stocked, they forecasted, they procured, and actually have stocked them, then they need to supply them to the respective counties and the districts based on need and demand. And therefore, in this particular case, we know we transition from the push method where KEMSA would push products to the facilities to the pool model where health facilities are tasked with determining quantities of what they need, then making a request to KEMSA, which will then supply them based on their internal arrangements and the contractual obligations and agreements. So that is a critical bit. The medicines have to be supplied. Then the other bit is the reverse logistics management, which is a critical bit. And oftentimes this is a neglected and actually ignored facet in terms of healthcare supply chain management. Because when you talk about reverse logistics, when products get to the pharmacies, let's say, for example, in a particular location, and these medicines are either faulty or they have expired in that facility over a period of time because they didn't actually, there were challenges in forecasting and the quantification, and therefore we got substantially higher, which expired. These need to be recollected and in the reverse logistics to ensure if they are being recalled from the market because of faults and challenges, then who is going to manage it? How does that work? KEMSA has a role in that. If there are expiries, How do we manage the recollection from the individuals in the community through the primary healthcare facilities, from the primary healthcare facilities to KEMSA warehouses, maybe in the regional areas, then to the head office where they now would look at destruction process to ensure we are destroying our pharmaceutical products and health products and technologies in an environmentally friendly way, and also in a way that we actually dealing with them according to the recommended standards on destruction of pharmaceutical products and health products and technologies. So that's a critical bit. And looking at that whole continuum, then we have to ask ourselves, that is the role of KEMSA. There are different stakeholders that are coming in. So how do we have KEMSA doing additional roles? And what are these additional roles? There's the capacity building bit, which is a very critical bit. And I think KEMSA needs to take a priority role on this. One thing is when you're supplying different counties and different public health facilities, there's that focus on ensuring we have local primary healthcare facility with the competent, qualified professionals who, one, they can focus on what quantities of products they need and when will they need them. That would be informed either by the epidemiological profiles of the condition that they're dealing with, the number of patients they attend to in that facility, and looking at even the environmental dynamics in terms of there are certain times when we have high peak of malaria and low peak because of the environmental changes. We look at it from influenza, not influenza, the birth rates that we have, for example, in vaccination cases. If you recorded a number of antenatal clinics that have been taken for that period, then the prenatal clinics should inform the quantities of even the vaccines that we'll be requiring for through KEMSA from the Kenya extended program on immunizations. So we need to look at that. But for that to happen, we need competent individuals who can actually do that forecasting, do the quantification, and make the request to KEMSA for the supply to be facilitated. And therefore, that is a critical bit that KEMSA has to put in place and ensure that is running concurrently. That will ensure that we have functional working systems within the local public care facilities, but at the same time, it's integrated into the regional and to the national KEMSA management system. And therefore, we're getting value for money because we are not getting overstocking, we're not getting challenges in terms of our supplies, and definitely our patients will be able to get the medicines. Because one of the critical challenges that we have in our facilities is that patients go to a pharmacy or a hospital and they're not able to be treated because we either don't have medical equipment that are needed for respective different medical procedures, or the medicines are not available and therefore they have to go buy them out of pocket, which makes it costly for them. So how do we blend these and how do we ensure patients can get the optimal value for service, and also the people who are delivering services are competent to make that happen? So that is a critical bit for us. Then the next phase is information systems management and research, which I believe is a critical bit as well, because we're talking about quantification, we're talking about forecasting, we're talking about information management data. How much quantities of what particular products do we need at what point in time and how do we need them? And also the research component where we need to know what are the drivers for these kind of challenges, what are the shortfalls in our system, how do we improve on them? And that is a role that KEMSA has to play. Establish a research workforce that would look at the pharmaceuticals, healthcare products and technology supply chain system to know what shortfalls do we have, what are the probable interventions that can be instituted, and how do we translate these research findings to actual implementable practice components and ultimately to policy frameworks to ensure there's sustainability of this kind of discussion that we're talking about. So that is a critical bit for us to see how do we make that happen. That is the research. In terms of information system management, when we're talking about the reorder levels and all that, I believe we can have an information management system and digital platform where KEMSA would be integrated to from a local national hub to the regional hubs, then from the regional hubs to the different counties, then from the county facilities that are actually managing most of the supplies to the respective facilities to the public primary healthcare facilities. Therefore, there's visibility. And that visibility makes it critical, end-to-end visibility from the main supplier, KEMSA, to the ultimate facility that is dispensing the medication so that they know at any one point, what are the consumption levels at the primary healthcare facility, rather than going the paper-based calculations where we might miss a couple of entries, and missing those entries is going to affect the overall quantities of what we are needing and how we are managing them. Another thing that is critical, even that can also encourage the rational use and optimal use of medicines and healthcare products and technologies, because if you're taking a particular medication, then you need to ask yourself, how many diagnoses of a particular condition did we get in that facility to actually warrant use of that kind of level of products and the different groups of products and technologies? So let's say, for example, you're talking about anti-malarial products. They are definitely only used for malaria. If we had 1,000 quantities being consumed in a month, and then when we look at the epidemiological data that is collected through the information management system, we have 1,000 quantities dispensed and quantities used, but then out of the whole batch, we find that diagnoses for malaria were only made for 600, 700 patients. So where the other 300 or let's say 400 malarial products, the packs. So those are the key things that we need to look at. And the health information management system, an integrated one, could give us the visibility, to give us the ability to see where are these gaps coming in and how do we close on them to ensure we have a reliable and efficient healthcare systems information management system, and also supply chain management to ensure primary healthcare services are optimally being delivered to the people who need them. And other than that, in the healthcare service delivery component, the rational optimal use, I've mentioned it with regard to the information management system, but the other bit is building capability in these local healthcare facilities where the healthcare providers are enabled to actually rationally use the medications, offer the counseling and guidance to the patient so that in case of any challenges, they can recall, get back and engage with the healthcare practitioner. That is a very important bit. That is on rational use of health, rational and optimal use of health products and technologies. And beyond that, even in that service delivery, we need to engage and see how will the primary healthcare facilities engage with the communities they serve so that they get the best service. But in case of any shortfall, this can be reported to be improved on. In case they have medication they've not used, they don't misuse them in their communities and therefore could bring them back. That is going to help us curb the menace of antimicrobial resistance, opioid overuse, and all that kind of challenges, and even the rational disposal of medicines that might affect our environment in different ways, especially in the bioenvironment, biosystems that we deal with. So those are key things that I feel KEMSA has an opportunity to address and actually to position itself as a national authority and agency that can deliver on our supply chain needs, integrate itself into the primary healthcare system service delivery model, and address the shortfalls in the public sector. And if that is done, we'll have captured a bigger stake of it. Then now the ball now moves to the healthcare practitioners and the national government in terms of the financing, and also the county government in terms of resource allocation and coordination of those different functions. But then there will be a starting benchmark of what has been done by KEMSA, and that sets the stage for us. So in the next steps that I think would be key is strategic alignment by the KEMSA management team, and that should be in line with their mission to ensure there's a reliable supply of health products and technology in the public sector. And on that account, then the different pillars have to be addressed in the health system pillars as we talk about the service delivery. We're talking about supply chain. That is the core mandate of KEMSA. We're talking about health workforce development. Research is a key bit. Infrastructure, what infrastructural needs are there? So what are their areas of play and how do they take advantage of those? And once they identify those and have a strategic alignment of their mission, then they now leverage on the technical capabilities within the workforce, whether they're in their workforce as KEMSA employees, consultants in the ecosystem, and also the pharmaceutical sector players who have a mission and an interest in helping champion for such advancements. And I think if we are able to deliver on that, KEMSA would be on another level, and we as a society would be able to get the benefits from the services that we expect from the government in health service delivery, but also be content that the money that we're investing in our healthcare system is working for us rather than working against us. And that would be a critical bit for us. So thank you so much for engaging. If you enjoy these discussions, I encourage you to subscribe to the channel, share with your colleagues, let's have the conversation going, and most importantly, ask the questions so that we see what can we address, what do we need to improve on, and how do we make that improvement sustainable and long-term in terms of giving us the value we expect from each other. Thank you so much. Please subscribe to the channel.